The depths of depravity within the Medicare Advantage marketing world know no limits whatsoever. Look at the new piece that's going around the internet today from Anthony Hopkins.
All seniors on Medicare. There's a new benefit out for anyone on Medicare where you can qualify for a flex card that allows seniors to pay for groceries, over-the-counter medicines and other supplies, as well as help pay down your utility bills. And it's completely no cost out of pocket to you. I'm going to make it very easy to show you how to claim these. It's completely free and only takes 30 seconds. So step one, there's going to be a little link on the bottom right corner of this video that's going to say sign up or learn more. Tap that button and it will take you directly to this website. Afterwards, you just have to answer a few short questions. It will only take you around 30 seconds. And right after you finish, it will send the flex card directly to your mailbox at no cost out of pocket to you. Tap the link below now to claim your flex card today. You still have a couple days before the deadline approaches.
That's pretty sick, pretty disgusting, because you know what? That's not Anthony Hopkins. Using 11 labs and the voice synthesis, you can create anybody saying anything. And this Medicare Advantage only agency literally created that and ran it on Instagram to try to get people to buy into Medicare Advantage. It's so disgusting. I'll show you one more clip, but then I want you to hear from a congressman, and his name is Congressman Greg Murphy, who's also a surgeon, and his experience with Medicare Advantage. You don't want to miss that.
Noted now, 20 years later, is to the point that almost half, and in some cities and districts, well more than half already are enrolled in this program. It is a private program. It is operated by private insurance companies. They're lured into these plans with deceptive advertising. The plans feature things that are common in private plans, but not in traditional Medicare, such as prior authorization. Doctors have to get permission in many cases from the insurance company before they can treat their patients. Inadequate networks, particularly as people get older and sicker, and very, very high out-of-pocket cost if people knowingly or inadvertently go out of network. So it is a program that absolutely should be called disadvantage.
The commercials that keep coming out about Medicare Advantage only give you not even half of the story. So here's what happens in real life with Medicare Advantage. If you've not yet heard the thousands of other stories from people, including Health and Human Services Office of Inspector General, including the American Medical Association, including the...
Be waiting to two or three or 4 weeks to speak with somebody who's not my peer. I'm a surgeon. I may be speaking with a pediatrician, or even more, I might be speaking with a nurse practitioner who has no experience whatsoever in my field of study to get their approval of something that I know needs to happen. It's an absolutely antiquated system that does not work. And I'm going to give you a couple examples. Approximately 10 weeks ago, I saw a prostate cancer patient. There were two avenues to go on this. Either he needed to be operated on very quickly, or it was out of the cat was out of the bag and he needed intensive chemotherapy quickly. A week goes by, 2 weeks go by. What's that patient doing at home? He hasn't slept one wink because his entire future, his entire life is then suspended in front of him. It took 3 weeks to get the study that every urologist in the country knew was necessary to get that answer. Yet in the meantime, that patient has lost years just in life as far as worry. Because I look at the savings that we as physicians provide in knowing what's right for our patients in the moment versus some bureaucrat in an insurance company who's given the directive to deny is not what we should be doing in medicine. Our medical system has become bankrupt, and part of these pre-authorizations are part of it. This is
kind of bait and switch plan. They bait people to come in with the promise of providing more, but in fact, many of the beneficiaries receive less. Correct?
Well, I certainly wouldn't put it that way.
Past the time when this should have been done. I look at the doctors that I have worked with, and we're just plagued in clinic because we know what we're going to recommend for our patients. After years of study and work with patients, is going to be possibly been denied by someone who has no experience, who's been told by insurance companies, deny, until they wear out the doctor and wear out the patient.
But I don't know that it needs to clarify because it's already a rule that Medicare Advantage plans must cover the same as must provide at least the same benefits as original Medicare.
And that is exactly my point, that it's not a problem with rules, it's a problem with compliance and enforcement. In other words, the Medicare Advantage plans basically have been flouting their obligations under existing law without a new rule, correct?
Absolutely correct, yes.
And a new rule is only as good as their being willing to change their real-world practices and CMS enforce those obligations, which it has been failing to do.
Maybe it will happen soon, but as I record this right now, today, we're in the annual election period where people are making what could be life and death choices as to what they're going to be on for the next year. So what is it that you should be looking out for? Let me tell you what you should not be looking out for. How many extra benefits can I get? What kind of a flex card program can I get? Can I get silver sneakers? Can I get a dental program? No, what you really should be looking at is what's involved when I need to go to a hospital. What's involved if I need to have surgery, when things hit the fan. That's what insurance is really about. Think of your car. When you have a car, you get insurance for the car in case it crashes, right? You don't have insurance to replace your windshield wipers, to put gas in the car, to even change your tires, even though that can be expensive. That's not what insurance is for. Insurance is for the big stuff. That's what it's for, not just the little perks.
Are trying to enroll in Medicare coverage for the first time. They meet with a broker or see an advertisement about Medicare Advantage plans offering $0
How about the fake ones from movie stars?
premiums and boundless supplemental benefits. Sounds good, sometimes too good to be true. Are advertisements like this misleading? And if they are, what should federal government, what should we be doing about it?
They are, and this has gone on for years. On all of our public presentations and our counseling, we beg the consumers, do not choose your health, your prescription drug coverage based on an advertisement. The advertisements will focus on the zero premium, zero copay at a primary care, maybe no copay for generic medication. But we really want them to look at things like, what is the copay for inpatient hospitalization per day? And when it comes to Medicare Advantage, also know that maximum out of pocket, which would be a limit to their financial risk. So the advertisements over the years have gotten more aggressive, and they do focus on those added benefits, specifically cash allowances, debit cards, money to go into the local drugstore and purchase items that aren't covered. And we have counseled numerous individuals, especially over the past open enrollment year. They were very upset with us because we could not use Medicare's Plan Finder tool to order the plans in order of the highest debit card to the lowest. And when we try to circle back to things like their specific providers, mental health needs, and other critically needed services, they really want to focus on those added benefits. And that has been a challenge for us due to the advertisements.
So is there, and I understand the federal government's recent steps to curb deceptive marketing help seniors sign up for Medicare coverage. Is that helping? Could you see some of that?
We are cautiously optimistic. We'll know more as plans go into effect in 2024. Personally, I've seen a bit of a difference in the commercials that are aired on television and the online ads, but there's still, and I get it, consumers with limited incomes, limited resources, to have those added dollars each month for groceries or utilities is a need. But if we can focus on the critical need, which is their health care and their medical needs, it could hopefully redivert them into plans that are best suited.
Plans that are best suited. So look for the big stuff first. I recently did a video about the max out of pocket with Medicare Advantage and what that really means. Remember that the Part D component of your Medicare Advantage plan does not, it's the money that you pay in there does not go toward your max out of pocket. There's a deductible on the prescription side in most cases, and none of that goes toward your max out of pocket on your Medicare Advantage plan. We've been exhausting ourselves here, working, it seems like around the clock, trying to help as many people as we can to go from Medicare Advantage to original Medicare with the supplement. Some people going from original Medicare over to Medicare Advantage. But what I wanted to point out to you is there's a time frame, but I don't want people to get panicked and freaked out about the time frames in the wrong way. So let me just show you this. There's the time frame on the two different ways you can go. You can be on original Medicare, which you start off with when you're new to Medicare, and you can get a Medicare supplement. You can do that 365 days a year. There's no time that you have to do anything with your Medicare supplement during the annual election period, which is this time, October 15th through December 7th. But on a Medicare Advantage plan, you can sign up for it between October 15th and December 7th. You can add or change or drop your Medicare Advantage plan. Please don't drop it without professional guidance to make sure that if you wanted a Medicare supplement, you were able to get one. And then there's another period of time that starts January 1 until March 31st. And that's when you can change your Advantage plan. You can change your supplement all year long, but you could change your Advantage plan from this period, January 1st until March 31st, or you could drop it all together and go back to original Medicare. If you do that, again, please come to the SSN website, which SSN stands for Senior Savings Network.org website, and go to the Medicare Help section and click on the button that says Medicare Advantage to Medicare Supplement so that we can guide you through the process so you don't make the mistake of, as somebody's already done this year with us, they want to make an application with a Medicare supplement, but what they forget is you have to get approved with the Medicare supplement first before you cancel the Advantage plan. So don't go cancel your Advantage plan if you have not yet obtained approval on your Medicare supplement, if that's the way you wish to go. We can help you with that. We are overwhelmed right now trying to call back over 1,000 people that are on our list that we're trying like heck to call back. I will tell you, if you're in a Medicare Advantage to a Medicare supplement situation, you want to change it, we're getting close to running out of space to help people through the underwriting for this year, but that opens up again in January. So we can work with you January through March 31st to go through an underwriting process with Medicare supplement. Right now, we're really trying to focus on those people who have a December 7 deadline. If you already have a Medicare supplement, you do not have a December 7th deadline. You just don't. You don't have to do anything right now with your Medicare supplement. Even if your Medicare supplement renews in November, December, January, because it will automatically renew. The thing about Medicare supplements that's so neat is they will renew for life as long as you continue to pay the premium. That's the only thing you have to do. Your rate may go up a couple of dollars, but you can change and shop that plan all year long. So if you can shop that plan all year long, wouldn't it be better to do it outside of the period where those that are doing Medicare Advantage work only have a finite period of time, like December 7th? So if there's anything we can do to help you get on the December 8th and forward calendar, please do that as you see our tools. Unless it's specifically related to Medicare Advantage, please do book times with us after December 7th. I'm saying that because I don't like people being frustrated. And right now people are getting frustrated because they expect that if they call us, we'll call them right back. And they'll call back literally 2 hours later and say, you didn't call me back yet. I wish we had 400 million thousand billions and billions of agents here working all year long, but we just don't. We're a small shop. We help people one-on-one, and we take the time with them to understand their situation before prescribing a remedy that we can then help with. I got a comment last night. How do you get paid on this? What's in it for you? Why are you doing this? Why are you working 12 and 15 hours a day? I made a website on that called howdoyougetpaid.com. If you want to know how we get paid as agents, why we're so incentivized to do this business, go to howdoyougetpaid.com. I go in there and talk about Medicare supplements because that's 90% of what we do. But on the Medicare Advantage side, we do make more money if you're brand new to Medicare or if you're getting into the Medicare Advantage world for the first time. I don't do it for the money. I do it for the lifestyle. I have a team of people in there, 20 people that are helping people as hard and as fast as they possibly can. We started this with just my wife and me when I left law enforcement as a way to probably give back in a different avenue, a different way of giving back than just doing the law enforcement, and what it felt like when I was doing law enforcement was it felt like it was just being a human garbage collector. Really, I mean that's what it felt like. So I felt this is a way we can also give back and build a legacy for our family, which we've done. So if there's anything we can do to help you, please reach out to us. But please, 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 please be patient with our office. Our agents are doing absolutely everything they can to be all things to all people. And that seems like it's an impossible task, but we're doing it. And if there's something we can help you with after December 7th throughout the rest of the year regarding Medicare supplement, if you're brand new to Medicare, you want to look at those options, then please do give us a call. We'd be happy to help you. Thank you. God bless you. And thanks for watching.